The Japanese attack on Pearl Harbor on December the 7th, 1941, here dramatically shot by Japanese film crews for propaganda purposes, not only crippled America's Pacific fleet, it changed the course of history. Just the day before the raid, President Roosevelt had personally appealed to Emperor Hirohito not to drag their two countries into war. But it was too late. Japan had formed a secret pact with Germany to attack the Allied forces in Europe and in the Far East.
So, after Pearl Harbor, lots of men volunteered for the armed services, and many were drafted. This also put the domestic economy in stress, as there was an increase now for war materials. So, Roosevelt's administration at that time set wages in each industry. And what happened was firms then began to have to compete for labor. This brought many women into the labor market for the very first time. And so the labor board determined that health insurance was not to be considered a wage. So what firms did to counter this scarcity of labor was they offered health insurance to employees. I'm sure many of you recognize this picture. This is Rosie the Riveter, and that was part of a marketing campaign to get women into the workforce at that time. And the slogan was, "We can do it." Another turning point at that time that contributed to the rapid growth of health insurance was organized labor. Organized labor was growing, and it was deemed as very positive at that particular time. Organized labor's grip on health insurance was strengthened with the 1947 passage of the Taft-Hartley Act, which defined health insurance as a condition of employment, therefore a subject for collective bargaining. Here the longshoremen were able to strike and not unload the military ships because they were bargaining for health insurance. Finally, the third reason for the rapid growth in the 1940s and the 1950s was in 1943, the Internal Revenue Service ruled that employee-provided health insurance benefits were not subject to federal income taxation. This was huge. The reason this was a game changer was that the tax code effectively encouraged employees and employers to shift compensation towards untaxed health insurance and away from taxed money income. Alright, so closing out our conversation about the 1940s and the 1950s, the insurance industry saw the American Hospital Association spin off Blue Cross in the 1960s. Later on, Blue Cross merged with Blue Shield in 1977. So you had Blue Cross, Blue Shield, and they pretty well dominated the industry up until about the 60s. Before we leave the 40s and the 50s and get into the 60s and 70s, let's take one last look at the P-51 Mustang, which is probably one of the coolest World War II planes ever built.
Rick, chill out, man. The war is over. We're in the 60s now. Get your ass in the bus.
You need to chill out with Fox. It's the 70s.
Let's get down to business. In 1960s, health insurance companies started to settle the premium according to experience rating rather than community rating. So what is experience rating? This high-risk group of people was more self-selected to these plans, so there are adverse selection, and the insurance companies tended to bear most of this burden, the cost burden, because high-risk groups are tended to use more hospital care. So they have to settle the premium according to their risk profile. So that is experience rating rather than community rating of all the people, low risk and high risk people in the same pool. So from these high risk insurance pools, they also tended to exclude the pre-existing conditions of the people, and that is a specific thing that is that cannot be done after this 2010 Affordable Care Act. So Affordable Care Act explicitly mentioned that pre-existing condition cannot be exempted or cannot be excluded from the health insurance plans. Now in 1960, the defining moment in US healthcare system was in 1965 when President Johnson signed the Bill of Social Security, which passed the Bill of Medicare and Medicaid. You can see in the picture that Lyndon Johnson is signing the bill with ex-President Harry S. Truman beside him. And what was the rare opportunity moment of US healthcare reform? That in the both houses, Democrat got the sheer majority and passed the bill with real ease. And in later part of these 50 years, we saw that over and over again that major reform attempt was thwarted by the opposition. So it was a rare opportune moment, and three-layered Medicare Medicaid cake was passed in 1965. So what was these three layers? So Part A was the now Medicare Part A, and that is the hospital and nursing care coverage for the elderly people more than 65 years of age. And in the Part B, that was Republican mandate, that was coverage of physicians coverage, and that is voluntary part. And in Part C, that was just like afterthought of Medicare, and Medicaid was passed to support the low income people, and it was given to the state's discretion that they can choose their own Medicaid program. So these two programs are still there and is a very much a defining part of this US health reform after even 50 years. So here you are seeing the Studebaker car, and this Studebaker car company is bankruptcy led to an act which defined the US health reform in a great way, and that the act name is, in 1974 Congress passed this ERISA bill, which means that Employee Retirement Income Security Act, and it explicitly mentioned that each and every company should have some income security plan for the retired employees. So what was the important thing of this ERISA? That the provision of self-insurance and the exemption of tax, exemption of the state tax, motivated many companies to self-insure themselves, large companies actually self-insure themselves and thus take the tax exemption. So even now the employee based health insurance is 58% people are covered by this employer based health insurance, and this provision of tax exemption is the main driver of this employee based health insurance. And that Rick mentioned that it started from the Second World War itself. In 1980s, the cost containment effort was evident because health care cost is rising up and up. So in 1980s and 1990s we saw many health cost containment efforts, and DRG, diagnosis related group, was one of them. And it was passed in 1983 during George W. Bush Sr.'s regime, and it actually coded many hospital inpatient services into one singular payment, and these DRGs were able to contain the cost of Medicare health services. And HMO Act was actually passed in 1973. I am mentioning in 80s context because after passing the HMO Act, it didn't go off to a flyer. After some time in the 80s, HMO was getting popular, and it was a main tool of this cost containment effort, because health maintenance organizations and later the PPOs in 1990s, the preferred provider organization, pool some doctors, physicians, and the insured population can go over to these preferred providers or the pool providers, and they can be served by these HMOs and PPOs, and they can use the utilization review and pre-authorization, these two kinds of technique, which contain the cost very much. And so HMO was successful in containing cost. You can see that premium got down relative to consumer price index in 97, but in 99 and later part of this 90s, managed care backlash was there. The distrust of the population that these HMOs were not serving themselves with the required care, that was the doomsday of HMOs and this managed care formula for health cost containment in US. But you can see it was quite effective in containing the cost. In the 1990s, an important act was passed by Bill Clinton in 1997, S-CHIP, that is called State Children Health Insurance Plan, and it covered the children up to 300% of federal poverty level. And this plan was just like Medicaid, where the state can choose their own plan and federal government is supporting the state in this plan. In the first decade of the 21st century, George W. Bush passed the Medicare Modernization Act in 2003 that created the provision of health savings accounts, and then in 2007 he extended the Medicare and it included the Part D, that prescription drug part, and we'll hear about this one in the Medicare section. And in 2010, 23rd March in 2010, the Affordable Care Act was passed, and that is now the buzzword in the healthcare sector in the US, and it contains many provisions which are affecting all the parts and bits of healthcare sector in the US, and we will look at those provisions in the relevant chapters. And one thing I can tell you that 2010 Affordable Care Act was devised after the Massachusetts reform in 2006, and the extension of Medicaid for all of the people, all underinsured and uninsured people, that is 50 million people who were uninsured in 2010. And the main provision, the main objective of this Affordable Care Act was to cover all the people. So not universal healthcare coverage, or we can say that near universal healthcare coverage is the objective of this act, and federal government is providing 90% of the Medicaid expansion cost of the states. It is very generous. It is more than any other provision that they are paying more. 90% is much more higher, but only 23 states are opting for expanding their Medicaid. And I can tell you that in 65 Medicaid was passed, and the last state was Arizona, who took up this Medicaid in 1982. So it will be the case for Affordable Care Act, and the reform in healthcare sector in US is not sweeping. It is always incremental. So Affordable Care Act may have this effect on all those aspects of this healthcare sector in US.